We always are working to encourage people to get tested, to know their status. That's priority number one, is to make sure people understand the importance of knowing their status. And the reason it's important to know your status is because you can prevent infection if you know you have it. Somebody who is in treatment and receiving care can be undetectable, and someone who's undetectable can't transmit the virus. This is a very manageable disease now. It doesn't have to be something that changes your life dramatically. And so that'll be a lot of our messaging and our communication. We're, of course, going to be doing everything socially distanced. So our communication around World AIDS Day will be virtual. We're working with the city to help bring some of the programs and needs in the community to light as well. So Mayor Van Johnson and First City Pride Center and Proud Savannah have been discussing those opportunities. We have to just continue to have this conversation because unfortunately, while this doesn't have to be life-changing, the reality is that it is for a lot of people because there's a lack of resources available. There's a lack of education available. The fact of the matter is that we have had PrEP for a number of years now, and PrEP in this community has only existed and has only been really accessible for a couple of years. We're talking probably 70% of the lifespan under which pre-exposure prophylaxis, which is a medication that allows somebody to have effectively similar results as condom use by taking a pill every day. It has not existed that for the bulk of the lifespan of this medication, people in this community have not had access to it. And where there is access to it now, it is limited. Many doctors will simply refuse to prescribe it to their patients. I can speak personally to that. I have spoken to doctors in this community who have told me plainly that they will not prescribe that any sort of prophylaxis to their patients. It is very unfortunate because condoms do break. People make mistakes. There is no reason to not use every tool in the toolkit to prevent HIV infections in our community. And so that's a lot of what we'll be talking about and what continues every day to be part of our message. We want folks to know that there are resources to keep them negative, that they have opportunities and resources to test and know their status, and that they have opportunities and resources to find care when should they test positive. There's no reason for anyone to fear this virus today.